So we're going to start with our first guest, John McLeod. John is a healthcare innovator tackling the persistent challenge of patient adherence. His health tech platform is designed to address barriers to adherence that arise between patient encounters. By strengthening the therapeutic alliance, his work aims to bend the curve on adherence and measurably improve patient outcomes. John, please tell us more about the work you're doing, and then you can go right into asking for what you need and offering what you can.
Thank you, Don. Hello, everybody. So happy to be here. So grateful to be here. As an entrepreneur in a startup, it's hard to find audiences who have any interest at all in what we're doing because we think we're breaking some ground. As Don said, my name is John McLeod. I'm the founder of Proxwell. And Proxwell is a health tech care management system that can be accessed from any device anywhere, and it's focused on managing care, in particular at home. I am not a healthcare insider. I've enjoyed a long career as an advisor to business owners, focused primarily on helping them build enterprise value, in designing a strategy to allow them to exit their business on their own terms. So I come to this as very much an outsider, and the reason I'm here, and what happened that resulted in my being here is my own 8-year journey with my mother, who developed dementia and lived about 400 miles away from me. So I found myself becoming her primary caregiver. I'm the oldest in my family. Mother came to me and said, John, she called me Johnny, I hope you will never put me in one of those facilities. And I said, okay, Mom, I won't. We'll do what we have to. And as the oldest, I think she knew I'd somehow figure out a way to do that, which I did. So as the primary, I spent the next 8 years, as I say, really kind of worrying about all the details of her care, how things were going from that great distance of 400 miles away. So I just sort of cobbled together calendars and text strings and phone calls and Zoom meetings with the care team to try to understand where things were at all time. And needless to say, my work and my family life and everything associated with my side of the equation suffered. Our vacations were up visiting with Mom. So she passed, and when it was all over, I stepped back and I thought to myself, gee, I'm not the only family member, or we're not the only family going through such a thing. There needs to be a better way. So I started talking to some friends about it and thinking through what the choices might be. We did some bench research. We couldn't find anything out there that brought all the elements, if you will, of managing care at home together in one place. So we decided to build something that would do that. My partner and we built something that we thought needed initially to just provide transparent connection and timely communication in real time, or enable, if you will, real time collaboration among families, caregivers, and care professionals. And we approached it the only way we knew how, as I say, being outsiders, and that's from the demand side. We were patients and families who were accessing care through professionals and trying to do as much as we could on our own. And we suffered from not really knowing what to do. And so all of that, of course, caused us some friction. But that learning translated well into what we think is a startup health tech platform here that's on the vanguard of using systems engineering and transforming how families can manage care at home for themselves and their loved ones. So we've done a lot of research. We've combined innovative ideas in medicine and technology. Behavioral science is important in our solution. Healthcare policy, we provide support and the flexibility that families need to navigate the complexities of caregiving at home. Very early on, and this is sort of even part of my own experience, we recognize that patient adherence, however it's supposed to happen, is a real barrier to outcome and to, if you will, successful implementation of quality of life as you would like to see it be, adherence to therapy. And then not having line of sight on that was very frustrating to me because I didn't know if the things that I knew needed to be happening were happening. So in designing Proxwell and building Proxwell, we put our interest in our design principles essentially into 4 areas that we consider the sort of the pillars of our health tech system. The first is structure, and the idea there is the belief that underlying framework, or essentially the structure you put in place, is going to drive the behavior of everybody who's supporting the care. Motivation, accountability. We recognize how busy everybody's lives are, and staying on task can be elusive. They can be discouraging. So consistent, regular communication, family member connection, and supporting care team collaboration, we felt was essential to driving recipient motivation, and care accountability. Timeliness is, we learned very early on, is very important. Even the best intentions will fall by the wayside if timeliness in some way is not built into the solution. So we have a very robust set of care tools that allow for notifications and alerts when things don't go the way they should, or if people are inclined to forget what might be next, or whether they're up to bat or it's their responsibility, or if their shift is due, that allows them to know that. And then the 4th pillar here is health literacy, recognizing that people such as myself come into this with very little knowledge of what's necessary. And even throughout the course of the journey, you're constantly on a mission to try to understand what's available and what can be done. And unless the connection and the collaboration is in place where you can observe, if you will, what others are doing, there's no peer-to-peer learning, no shared accountability, if you will. And so the members of the team kind of come in a silo and leave in a silo, and they haven't learned anything. And they haven't learned anything for their own purposes and transferring that knowledge to go somewhere else, but they also haven't learned anything in terms of applying what ought to happen next for the care recipient in question here. So we use the design principles of andragogy, which is all about adult learning, recognizing that adults learn best through self-directed and peer-to-peer experiences, experience that are differentiated based upon life circumstances, internal motivators, and the desire for quality of life. So every action within Proxwell is tracked and recorded and charted. So it provides care and health providers, if you will, or anybody who's an interested party, at a glance into insight into adherence or what activities have been taking place. So if something goes awry, we can immediately eliminate what didn't happen that should have happened and make a corrective action. That's a quick overview of Proxwell. Needless to say, I've got slides and decks, and I could keep you here all afternoon. We're not going to do that, and I've probably already lost you here. I hope not. But let me talk a bit about what I could use some assistance and help with, what I need, as I think we frame it up. We're interested as outsiders very much in feedback, expertise, advice. We are looking for advisors and board members. Ultimately, we're going to be looking for investors. We're not quite at that stage yet. It's still very much self-funded, and I am the primary investor. We're interested in real-world use cases, collaboration with other partners or partner organizations who would like to run pilots or use cases and implement this solution to strengthen it, to find out what's wrong with it, to how it could be done better, and what we can offer. I do have expertise, and this came up in another call I was on, in business formation and strategy development and exit planning. So I can help anybody who's trying to do a startup in the industry who's part of this. I could give you some advice there. I think I also very much can give a fresh perspective from the demand side and the reality of the fear, the uncertainty, the challenges, the discord within families, and all that family caregivers and family face when approaching aging in place, care, adherence to therapy, the alliance, if you will, between the care providers, the care professionals, and the families, or even just within the family members herself. And then I'd also like to offer to anybody who has a particularly unique care need that thinks this could help in any way, some complimentary access to try the tool. And that we're happy to do. If you have any interest or anybody else in the group that could use that, then reach out. So that's my story. Thank you.
Great. Thank you, John.